My name is Lacey. I have 3 children, 2 daughter-in-laws, and 4 grandchildren. And that is my heart and soul. I enjoy baking. I bake a lot, and I love to sit down with a good book. I love information. So if I'm interested in something, I'll seek out all the information about it that I can. What started my journey is incontinence. I kept complaining to my doctor about it, and he started running tests, and the 3rd test he ran, he found the cancer. When I found out that I had recurrent LGIR in MIBC, I was shocked. I would have to say I didn't feel anything for a while. I was just kind of numb. That diagnosis turned my life upside down. Taking care of the cancer just to keep going so I could raise my daughter. That's what my life became. My cancer was reoccurring every 3 months. I learned about ZUSDURI from my urologist oncologist at Loma Linda. My first experience with the treatment process was quite fascinating, actually, and exciting because I was part of something that was new and that might help me especially, but other people.
What excited me about working with ZUSDURI in this clinical trial is that it provides another option for patients with low-grade recurrent intermediate risk bladder cancer. These patients have a treatment option where the drug is actually ablating or killing the cancer. To have another option with potent tumor ablation, I think is really valuable for me as a urologic oncologist, and I think that definitely translates to the patients as well.
Mentally and emotionally, after the treatments, I felt hopeful. I can play with my grandkids. My hope for the future is that this helps other people in my situation. I just think, good things come when science excels. I've been cancer-free for over 2 years.
Approved use for ZUSDURI. ZUSDURI, mitomycin, for intravesical solution, is a prescription medicine used to treat adults with the type of cancer of the lining of the bladder called low-grade intermediate risk non-muscle invasive bladder cancer, LGIR-NMIBC, after you have previously received bladder surgery to remove tumor and it did not work or is no longer working. Important safety information. You should not receive ZUSDURI if you have a hole or tear, perforation, of your bladder, or if you have had an allergic reaction to mitomycin or to any of the ingredients in ZUSDURI. Before receiving ZUSDURI, tell your healthcare provider about all of your medical conditions, including if you have kidney problems, are pregnant or plan to become pregnant. ZUSDURI can harm your unborn baby. You should not become pregnant during treatment with ZUSDURI. Tell your healthcare provider right away if you become pregnant or think you may be pregnant during treatment with ZUSDURI. Females who are able to become pregnant. You should use effective birth control, contraception, during treatment with ZUSDURI and for 6 months after the last dose. Males being treated with ZUSDURI. You should use effective birth control, contraception during treatment with ZUSDURI and for 3 months after the last dose. Are breastfeeding or plan to breastfeed. It is not known if ZUSDURI passes into your breast milk. Do not breastfeed during treatment with ZUSDURI and for 1 week after the last dose. How will I receive ZUSDURI? You will receive your ZUSDURI dose from your healthcare provider 1 time a week for 6 weeks into your bladder through a tube called a urinary catheter. It is important that you receive all 6 doses of ZUSDURI according to your healthcare provider's instructions. If you miss any appointments, call your healthcare provider as soon as possible to reschedule your appointment. During treatment with ZUSDURI, your healthcare provider may tell you to take additional medicines or change how you take your current medicines. After receiving ZUSDURI, ZUSDURI may cause your urine color to change to a violet to blue color. Avoid contact between your skin and urine for at least 24 hours. To urinate, males and females should sit on a toilet and flush the toilet several times after you use it. After going to the bathroom, wash your hands, your inner thighs, and genital area well with soap and water. Clothing that comes in contact with urine should be washed right away and washed separately from other clothing. The most common side effects of ZUSDURI include increased blood creatinine levels, increased blood potassium levels, trouble with urination, decreased red blood cell counts, increase in certain blood-liver tests, increased or decreased white blood cell counts, urinary tract infection, blood in your urine. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. You may also report side effects to Urigin Pharma at 1-855-987-6436. Please see ZUSDURI full prescribing information, including the patient information, for additional information. ZUSDURI is a trademark, and Urigin is a registered trademark of Urigin Pharma Ltd. Copyright 2025 Urigin Pharma Incorporated. All rights reserved.